Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is radiofrequency ablation for back and neck pain treatment, which has been a revolutionary procedure in pain management. Here's some facts on back and neck pain. Back pain affects 90% of Americans at some point in time. It's the second most common reason people go to see a doctor, just behind the common cold. Back pain is the leading cause of disability in those under age 45, and up to 40% of those who have back surgery fail and end up with failed back surgery syndrome. Neck pain affects about 10% of the population at any one point. 50 to 70% of individuals have neck or shoulder pain at least once. When you look at the back of the spine, either in the neck or the low back, what you see are joints on either side called the facet joint. Okay, they're about the size of a thumbnail. They contain cartilage, and they help a lot with spinal mobility. They are prone to arthritis, just like the shoulder or the knee and other cartilaginous joints, but there's no successful joint replacement for this facet joint. When making the diagnosis of facet-related back or neck pain, what the pain doctor will do is utilize a combination of a history, a physical examination, looking at x-rays, CAT scan, MRI, and for instance, here's a CAT scan. And this is called an axial view. You can see the vertebral body here, the spinal canal. And you see these joints back here, how pristine they look. There's a lot of joint space. There's nothing ratty there. There's no bone spurs. Whereas here you have significant arthritis with minimal joint space left, a lot of bone spurring. See these areas here. And that is the definition of facet arthritis. Now, interestingly enough, the person on the right, they may have no back pain. So it doesn't always correlate between the severity of arthritis and the severity of pain. So it can end up being a coin toss, where even the best trained spine doctors, 50% of the time, get it wrong. So then they can turn to diagnostic injections. And there are two different types. One's called a medial branch block, which is where here's the back of the spine with the spinous processes, facet joint. These little nerve endings, called the medial branches, provide sensation to this joint. So a pain doctor can inject numbing and maybe some steroid and stop the transmission of that sensation and provide pain relief. You can also put steroid medication right into the arthritic joints. Okay, that's a facet injection, and that can give weeks to months of pain relief just like the medial branch block. Now, what is a positive result? Well, it varies depending on which insurance company is approving the next procedure. It might be 50% is considered a positive result. Some say 80% pain relief is necessary to be considered a positive result. And some insurance companies even say, you know what, it's got to be 80% pain relief on 2 separate procedures. So a medial branch block in and of itself may give 3 months of pain relief on average. And it can serve as both a diagnostic procedure where it says, okay, this is a problem joint, and therapeutic because it gives relief for so long. And when it wears off, it can either be repeated or move on to the radiofrequency ablation. It's got a lot of names that are identical. Radiofrequency neurotomy, medial branch neurotomy, thermocoagulation, denervation, lesioning. They all mean the same thing. Here are 5 facts about radiofrequency ablation. It's the same current used as the wavelength in radio signals. However, it has nothing to do with an FM radio. Okay? It can be more painful right after the procedure. We'll talk about that. Pain relief from an RFA may last for upwards of 2 years. That is one reason why it's been such a revolutionary procedure. And you do need to have the diagnostic injection prior in order for insurance approval. What exactly does a radiofrequency procedure do? Well, here's a view showing the facet joint with the soft tissue capsule around it, okay? And what you can see is that there's a nerve root coming out of the spine, and this little nerve ending, the medial branches, coming and supplying sensation. That's where the radiofrequency procedure works. You can see the catheter coming in here, applying thermal energy to the medial branches, and what it does is it deadens those medial branch nerve endings and provides pain relief that way. Just to note, it doesn't do anything on the nerve root, okay? You don't want to be there. So here's the actual procedure. It can look like this with the catheters going in. Multiple joints are usually treated at one time. And this is done with fluoroscopy, which is a real-time x-ray. Initially, the catheters are put in place and there's a stimulation put forth so that you want to make sure that a leg doesn't jump or that an arm doesn't jump, depending on where you are. Because if it does, the pain doctor is too close to the nerve root. Okay? Once placement is established, then usually it's 80 degrees Celsius, and you can see the setting here, at 90 seconds. That's usually what the pain doctor will do. And there's 4 setting here because there's actually 4 catheters that can be put in at one time. And that will deaden the medial branches. It's done as an outpatient, low risk, takes under an hour. Well, what are the results? A lot of studies have been done. It shows that pain relief can be for upwards of 2 years, and it's much longer on average than a steroid injection. Patients get greater range of motion, they lower their use of pain medications, and the recovery time from the procedure is significantly short. You can have some increased spasms for a week or so due to the procedure. Less than 5% of the time, a pain doctor will not quite deaden all those medial branches, and you'll actually end up with worse pain for a few months. A lot of times there's temporary numbness over the injection site. You can have rarely an incidence of spinal cord trauma. That's less than 0.1%. The average pain relief in one study was 15 months, 472 days. And studies showed that if pain relief wears off, like those little nerve endings grow back, and you have a repeat procedure, the same results can be expected. The Nevada Pain Network has multiple pain management doctors that are board certified, fellowship trained, and they take over 50 insurances at several locations. They've won the Patient's Choice Award 5 years in a row. They have pain management doctors, chiropractors, spinal decompression therapy, acupuncture, really a one-stop shop for your non-operative pain management needs. The phone number to call is 702-323-0553, and check us out on the web at nevadapainnetwork.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.